Good afternoon. Thanks for taking the call today. Just circling back to some stats earlier in the presentation, 26 COVID patients moved to ICUs away from Northern Health, and they are, as noted, not vaccinated. Both the Minister and Health Minister and Dr. Henry talk about leadership and getting vaccinated right now if you're not in British Columbia, Canada, nay, the world. Up in Northern Health area and certainly in the Peace region, we've had a couple mayors go on the record as saying they're pro-choice as it relates to the vaccine, and a handful of chambers also note some vaccination passports concerns. Either the minister or Dr. Henry, how do you respond to that? Your call for leadership when we have community leaders in this area, quite frankly, doing the opposite and going on the record as being in opposition to your recommendations as the health experts of the province. And how does that work in your battle against shambolic vaccination rates in certain areas of the province like this one?
Yeah, I'll let the minister take most of this, but I just want to say I've had the privilege again of meeting with with many of the mayors and local elected representatives across the north, and they have been 100% supportive of the important role that they play in providing advice and guidance and leadership in their communities. And it is important for local people, despite some of the pushback that they get from some people in those communities. And in every community in BC, there are more people who are vaccinated than not. And that's by an increasingly greater margin. So we need to make sure that we're putting out that important, good information, that we're countering the misinformation and the disinformation that is making people sometimes afraid, and that we make it very what's the right word? That we're very explicit about choice is one thing, but choice has consequences. And when those choices you make are having effects on the rest of your community, then that has implications. And it means that you are restricted from doing certain things. And that's the point of the BC vaccine card. It's to show people, to remind people that the choices they make have impacts on others. And we're seeing that in the north now, particularly in the Peace region, where people have to be transferred, where people can't get the care that they need. So all of us need to stand up and make sure that people have the information they need to make the right choice.
Thank you for the question. I just say that there are 32 patients that have been transferred since we started to do this some weeks ago now. 26 of those patients are positive for COVID-19. 6 are in other circumstances, but we're best to receive their care elsewhere. But what it meant for all 32 was being flown by air ambulance from their home communities. There are, I believe, 22 of them came to Vancouver Island, which is a long way from Vanderhoof and from Smithers and from Pouskoupi and from Dawson Creek and from Fort St. John and from Prince George. It's a long way. It's hard on them, it's hard on their families, it's hard on the healthcare workers. It has an impact on surgeries, of course, everywhere, including on Vancouver Island. I want to say this, though. I'm very proud that we're doing it. It's absolutely the thing we need to do, which is to support one another in difficult times. That our workers in Northern Health have been doing exceptional work under difficult circumstances. And people in our healthcare system around the province is responding to support the North, just as the North supported other parts of BC at other times in the pandemic. Northern Health, Northern Health and communities in Northern Health have, I think, been incredibly supportive. We are providing care to everybody, no matter what your circumstances and no matter what your vaccination status. But we are saying this, that the more people who are vaccinated, the better off we'll all be. And I think, and I would say this, that when you have a diagnosis for COVID-19 and you need critical care, there's no choice anymore. And it's not a choice, it's a decision people are making. I'm also proud of our mayors in the North and our MLAs in the North. people such as Shirley Bond and Nathan Cullen and Jen Rice and Mike Bernier and Dan Davies, John Rustat, Coralie Oakes, our representatives and MLAs in the North have been unanimous and passionate in their efforts to support vaccination. I think this reflects an incredible degree of leadership at the provincial level, and our mayors as well. And I'll just cite particularly in the Northeast, Mayor Bumstead, Mayor Ackerman. Mayor Bumstead called me on Monday. We spoke on Monday about the importance of working together and working with businesses and how we can encourage and raise vaccination rates. And I think we're having some impact there. So I think our leaders in the North, in their vast majority, and by vast majority I mean 95, 96, 97%, have been incredibly supportive, and they're necessary, and they're making those efforts. And we need everyone to get involved. This isn't calling anybody out, but this is saying that right now in this pandemic, we need everyone to get vaccinated, and that's especially the case because of case counts in the North.
Rob, do you have a follow-up?
Both have mentioned, there's consequences for their choices, and Mr. Dix talked about the mayor of Dawson, and speaking to you on Monday, he was on video last week on the front lawn of City Hall advocating choice. Again, and again, the mayor of Pouce Coupe specifically has called the minister a liar, saying ICUs are empty. How do you respond when you have leaders, even if they're at the provincial level responding positively, at the local level they are on the record as being pro-choice and not get vaccinated right now?
Well, I'd make a distinction between those statements. Mayor Bumstead has consistently supported vaccination. I've talked to him multiple times. We're working together to see vaccination rates increase in Dawson Creek. As you know, they're around 65 or 66%, which is below where they are, for example, in Fort St. John, and we hope that a sense of municipal competition will raise those higher. I mean, I just think, I just say that our healthcare workers deserve better than leaders suggesting that they're not dealing with what has been an unbelievable pressure in our ICUs from people sick with COVID-19. It is a very challenging time. Maybe talk to the healthcare workers on Vancouver Island who are treating people from the North, the healthcare workers in the North who are treating people in the North, the healthcare workers everywhere in BC. This is just something we have to do together, which is to get vaccinated. It's very straightforward. If you are not vaccinated, you are vulnerable to this pandemic right now. It is in great degree a pandemic of the unvaccinated right now. And we need everybody, everywhere, to do their part in that effort for themselves, for the ones they love, for the ones they don't know, for people in other regions. I think British Columbia has gone together to an extraordinary degree. And let's face it, 89% of adults, 88% overall are vaccinated. And that shows that that's an expression in real form. That's not a vote. That's not a survey. That's people getting vaccinated. And we need those numbers to increase. And even in a community such as Dawson Creek, which is at around 2/3 of people receive their first dose immunization, that's still 2/3, right? And so I think that we have a lot of support in the North. Our healthcare workers deserve better than people diminishing their work. They are working flat out to help people. And we have some of the best outcomes for people in critical care. But you know what would be better? Fewer people in critical care with COVID-19. You know how we deal with that? We get vaccinated. It's free, it's available, get it done.